psychologist here in the province. That's Dr. Janine Hubbard. Dr. Hubbard, you're on the air.
Good morning, Patty.
Good morning to you. Thanks for making time for the show.
Oh, thanks to you, as always.
So there's 210 registered psychologists in this province. You received responses from 111 of them associated with a variety of things concerning their profession. Number one, what do we know about where psychologists are working, public versus private sector?
Well, what we've seen is a shift over the last number of years. Back in 2017, roughly, over 70% of psychologists were working in the public sector as their primary place of employment. And now we're looking at 57% of psychologists listing public sector as their main source of employment. So we're seeing a real shift, which echoes what we've been seeing over the last number of years, which we raised as an area of concern around this time last year, that we were seeing this mass exodus of psychologists from the public sector.
And so what does that mean in real terms? Is it just simply the extension of how long you'll have to wait to see a psychologist? Are there any specific areas where they've left in droves that is a major concern?
Well, absolutely. It means that very often you're not able to see a psychologist because the positions have been filled with other mental health practitioners, which in some cases can be really helpful. But we are really concerned because in many places in our public sector positions, the vacancy rates are 50% or above. And so that means that being able to see a psychologist is involving extremely long wait lists, if there is even a psychologist now associated with that program.
So that's a snapshot of today. What does that mean for the future insofar as graduates from psychology schools for mentoring or on-the-job training or what's required?
Well, again, what we've been seeing, fortunately, over the past year is sort of a stabilization. We've seen a few people leave. We've had a couple people join, so that the mass exodus has stabilized, at least for now, and I think some of that is due to some of the government initiatives that have been put in place, which is great, but we graduate very small numbers of psychologists, which means to try to backfill those positions, let alone create new additional positions, we're looking at either some massive recruitment from out of province or, it could be a good 10 years before you're looking at having the kind of numbers that would fill the existing positions.
Let's go right to one specific area in the K-12 system. Mm-hmm. The school district now, I guess, inside the Department of Education, there was staff of psychologists available to schools and their students, and I think for the staff as well. So inside that world, I know a little bit about it because I have a partner. My wife is a teacher. What are we seeing there?
Well, we're concerned there because we have a large number of those psychologists who are eligible to retire in the next couple of years. So we're not seeing quite the same number of vacancies currently, but the big concern there is we haven't had a training program in the province to train school psychologists since 2019, which means we have no new graduates to fill those positions. And certainly as the association, we've spoken with the Department of Education, we've spoken with the school board, we've, sort of suggested some proposals for ways to create a new training program that actually would attract people certainly from Atlantic Canada, if not across the country, because they know that these vacancies are coming and there's nothing in the works to train and fill the position. So we're not sure what they're planning on doing.
I don't know how to say it. How aggressive is the private sector in recruiting inside the public sector for psychologists?
Not at all. The thing is, most psychologists who work privately are working for themselves. It may be within an agency, but generally speaking, they are self-employed. So it's not that, we have large firms coming and saying, dangling all kinds of incentives.
Okay.
It's usually, to talk to most of our psychologists, it's honestly often their last choice. It's I've given the public sector the best I possibly can. I've been trying. This is the work I want to do. There are aspects of this work, whether it's the collegiality, whether it's supervision, whether it's teaching. There are all these things that people want to do in the public sector, and then sometimes they're doing a little bit of private on the side, like one evening a week, for example. But then at a certain point, they just say, I'm feeling really unhappy and I'm not feeling wanted or appreciated during the day, and there are private clients who are clamoring and wanting to be seen.
They talk about some of the areas that could be addressed to see them more content in their role, certainly in the public sector. And one is about understanding the role, the education or skills of a psychologist. I think people, if you've never seen a psychologist, have a base understanding of what a psychologist is offering, what they can do, and the training that they have. So where do you think some of the gaps are in public knowledge about psychology?
Well, and it's not even so much the public knowledge. It's been some of the decisions that have been made to treat all mental health professionals as interchangeable counselors or mental health providers of some sort. So it's not just psychologists getting lumped in there. There's often, 3 or 4 different professions. But treating all professions as a homogeneous group is not going to help because it doesn't allow for the skill sets of each of those groups to come out. And it means that basically nobody's practicing to scope. And sometimes it's being asked to deliver programs or being asked to deliver services in a way that really isn't very satisfying. And that is one of the things that we've heard. One of the factors that we know can influence things like workplace burnout is not having a voice at the table, not being included in decisions about how changes are maybe being made or how services are being delivered. And I know that's one of the very frequent conversations we have. And it's also a lack of understanding that psychology involves so much more than just the face-to-face therapy. It may involve diagnosis. It may involve psychometric assessment. It involves a lot of supervision and training and consultation. And these are things that when there's a focus on, the numbers, how many people did you see in a day, it misses out on some of that richer opportunity or the skill set that's available.
I assume some of that falls into the second bullet point offered about increased respect. But let's talk about autonomy. Where is that lacking? Because, I don't know how diligent the oversight is, the monitoring or what have you, or evaluation of job performance. What is included inside increased autonomy?
Well, increased autonomy is the ability to, using clinical judgment, using best practice, knowledge of the research, say, this is what I think this client needs in order to make the best progress possible. And maybe in some cases that is a psychometric assessment, which can be very time-consuming. But that might be what is in the best interest of the client. Or it could be a decision of, actually, you know what, this person, what they really need is service X. But service X, either we're not allowed to refer to them or there's some barriers that get in the way. So it's that ability to independently assess a client, determine their needs, and make sure that those needs are being met.
This is a very general question, but there's always been psychologists inside the world of mental health care. Mm-hmm. But the pandemic has been just a different kettle of fish, nothing that anyone has really experienced. I suppose if you're old enough to have been alive during the Spanish flu, you will have some recollection, but let's be realistic, the world has changed dramatically.
Yeah.
Not only how that's impacted healthcare professionals or mental health care professionals or psychologists specifically, but has your profession had to step back and think about the larger impacts of the pandemic, maybe shift how psychology is practiced?
Oh, there's no question. And I mean, there have been some positives that have come out of the pandemic. If you'd asked me 3 and a bit years ago what the heck a Zoom was, I wouldn't have had the foggiest clue. So things like being able to offer more flexibility, to be able to cover greater geographic regions through things like telemedicine has made an enormous difference. We've had a lot of people studying the impact of various aspects of the pandemic. From certainly we've seen increases in anxiety and depression. We've seen an impact on kids in their schooling. We've seen increases in eating disorders, but also kind of bigger picture things, looking at, the importance of social connections and socialization, and what does the workplace look like, and what are the aspects that are important to workers. For those in our industry who study what's called industrial organizational psychology, understanding all of those bits of society has been a huge impact on psychology, and I'm hoping, that we've been able to rise to the occasion. Even things on a bigger level, looking at behavioral change. How do you convince a population to engage in vaccination? How do you convince a population to engage in masking? How do you reduce some of the anxieties and fears around that? Those are all things that psychology has really kind of had to take the lead on in many ways over the last couple of years.
You know, we talk a lot about primary care teams and collaborative care clinics and all the rest. Do psychologists work in the interdisciplinary world, or are they standalones?
Well, they do exist in interdisciplinary world. Certainly, we have advocated a number of times over the years to be included in things like those interdisciplinary primary health care teams. Ontario's been doing that for a number of years, and that's actually one of the most sought-out public sector psychology positions in the province. It's well-paid, it's well-compensated, it's very collaborative. I know BC's been making some efforts in that area, and that's certainly one of the areas that we've been talking about, because if you can get in at the primary care level, you're often able to do a lot more preventative work, or sometimes it's short-term interventions as things are emerging, which then can prevent some of the longer-term issues. So we've certainly advocated to have psychologists on each of those integrated teams.
Of course, if you see a psychologist in the public sector, there's no cost out of pocket. In the private sector, do people have insurance to see psychologists, or is it all a cash transaction?
Some people do. Unfortunately, we have seen some employers really, especially with the pandemic, appreciate that the mental health needs of their employees are incredibly important. So we've seen them increase the amount of coverage that they provide in terms of psychological services for their employers. Not everybody has. So there are some people who actually have decent coverage that provides adequate care, and that takes some of the burden off of the public system. And I think it has always come down to there are some issues in some cases and some situations that are really well suited for short-term private practice, and there are others that really need the longer-term, the multidisciplinary or interdisciplinary teams that can be accessed through the public system.
Do I need a doctor's referral to see a psychologist?
You don't. Some insurance plans still required, although many of them have removed that requirement.
Really appreciate your time. Anything else you'd like to offer this morning, Dr. Hubbard?
Just that we're continuing to, make some gains. We've seen some progress with the government initiatives, and we're very appreciative of those. But we know that there's still a long way to go, and we're also highlighting the need for additional coverage for our own public sector psychologists to be able to take care of their own mental health.
I appreciate your time as usual. Thank you.
Thanks so much, Patty.
Take care. Bye-bye.
Bye.